This is the modified Thomas test, which assesses the flexibility of the iliopsoas, the uniarticular hip flexor responsible for hip flexion at the acetabular joint. The movement occurs at the acetabular joint and involves passive hip extension in the sagittal plane. This test is important because limited iliopsoas flexibility can cause anterior pelvic tilt, lumbar hyperextension, and restricted hip extension during daily and athletic movements. A tight iliopsoas keeps the femur in a flexed position and pulls the pelvis forward into an anterior tilt. When this occurs, the gluteus maximus cannot fully extend the hip, so the lumbar spine compensates by arching to achieve the motion. Over time, this compensation can lead to hip impingement, lower back pain, and inefficient gait mechanics. From a performance standpoint, adequate hip extension is crucial for sprinting, jumping, and walking. If the iliopsoas is shortened, it limits stride length, hip drive, and glute activation, all of these which reduce lower body power and efficiency. Scoring for the modified Thomas test is based on the position of the femur relative to the acetabulum. Since this is a qualitative test, it will be indicated by a green, red, or yellow marker. A passing or green result is when the femur is able to drop past the line of the acetabulum. This shows normal iliopsoas length and adequate hip extension. A borderline result is when the femur aligns directly with the acetabulum or shows any lateral drift or rotation of the thigh, suggesting mild thigh tightness or imbalances. A failing or red result occurs when the femur does not reach the line of the acetabulum, meaning hip extension is restricted and the pelvis or lumbar spine may be compensated to achieve adequate motion and hip extension. The participant will be seated near the edge of the table with both knees bent. They'll grasp one knee firmly and bring it towards their chest while letting the opposite leg drop down naturally while maintaining a completely straight knee. Now you're going to let it fall as far as you can. Keep that knee completely straight, and we're looking for the femur to pass the acetabulum for a passing grade. Some anchors include stabilizing the pelvis with one hand on the anterior superior iliac spine and monitoring for anterior pelvic tilt or lumbar extension during the hip extension movement. We would give this test a borderline as the acetabulum is just in line with the femur. It is very close to a pass.